guys. So the purpose of this video is to kind of teach you the way that shifts are calculated and what we mean when we're talking about well, which direction can we go if we use this image? As a radiation therapist, you're going to be looking at images all day and you're going to be comparing what the patient should be in, what position the patient should be in versus what their position they're in today. And you're going to have to shift today's position to match what was previously calculated. So when we're looking at imaging, especially three-dimensional imaging, you're going to have different types of slices. It could be axial view, such as this one. It could be a coronal view, such as this one, or it could be a sagittal view, such as this one. And each one will tell you two dimensions, right? Because three-dimensional images means you have three planes, but each individual image only has two directions. It is only when you have all three together that you're able to actually use the advantage of three dimensions. So individually, each image is going to allow you to know two dimensions. And how do you know that? My trick for you guys is always going to be, let's pick here, is literally going to be label each side of the image. So if this is your image, right? This is an axial slice. And I know that if this is an axial slice, then this part of the square is the anterior portion of the body. This side of the square is the left side of the body. This side of the square, since it's in the opposite of the left, must be the right. And this side of the square, since it's the opposite of anterior, must be the posterior. So once you have labeled all four sides, meaning anterior, posterior, right, and left, then you can determine, all right, so what directions can I move in this image? You can go in the anterior direction, you can go in the posterior direction, you can go in the right direction, you can go to the left. Which directions are not available to you on an axial view? Well, you can't see superior or inferior. It's just not there. You have no idea if you can go higher up or lower on the body. There's no way to discern that from this one image. Moving on to coronal, same thing. Label each side of the rectangle in this case. So up here, and you're going to learn this in sectional. This is why we take our time in sectional. But as we go through the course, you're going to know, oh, this is the head, this is the neck, these are the shoulders. So towards the head is superior, right? The opposite of superior, meaning the bottom part of this square, means that it must be inferior. And now we have our simple side. So I know this is one side of the body, this is another side of the body, which is right, which is left. This is where you're reading the chapter, understanding the images that you're looking at. You're going to know that the patient's left side is going to be over here to the opposite of your right side as you're looking at the screen. And if this is the patient's left, then by process of elimination, this must be the right. And now in a coronal view, I know that I can do superior, inferior, and I know I can do right and left. I can't do anterior, posterior. It's not available to me. I don't know where in the body, anterior, posterior wise, I am. It is just not something that's offered by looking at a coronal view. Now, if I have a coronal view and an axial view together, I can discern all three directions. I have anterior, posterior, right and left. I have superior, inferior, right and left. I have a double vision of the right and left direction, but I have also anterior, posterior, and superior, inferior, which are all three dimensions that we have to be familiar with. Finally, we got a sagittal view. So in this image over here, we have a sagittal view. I know that this is this is the spine, right? And the spine is in the back of the body. So if this is the spine here, this must be the posterior side. The opposite of posterior is anterior, so the opposite of the square in this scenario is going to be anterior here. Now, what other directions are left? I know it's kind of hard to wrap your head around this image, but I'll tell you right now, this is the patient's tongue. This is the patient's mandible, which means that up here, this is the nasal cavity. This is going to be superior towards the head, and then inferior towards the feet. Okay, the opposite. Each slice, or not each slice, each view is going to have different shifts available to you. If it's an axial slice, you're always, always, always going to have anterior, posterior, right, and left. If it is a coronal slice, you will always, always, always have superior, inferior, right, and left. And if it is a sagittal slice, you will have superior, inferior, ant, and post. It sounds like a lot of information, but you're going to be looking at images all day, every day as a radiation therapist, and this is going to become second hand. You're not even going to have to think about it. But right now is the time when you need to learn and build on these skills and start coming up with mnemonics that make it easy for you to remember this. I think once you wrap your head around the ability to be able to label each side of the image, you can then move on to, okay, so now that I know what's available, now that I know what's what, I can determine what's available to me and what kind of slice I'm looking at and what kind of shifts I can perform. The other thing that it's really important that you guys start practicing now is grouping these shifts. So the anterior posterior direction, so these two together, those are known as vertical shifts. So this is a table vertical shift. Anterior, posterior is vertical direction, the Z direction, dimension. Right and left, so let's pick a different color. Right and left, these are known as lateral shifts. So if I give you this image and I say, what kind of shifts can you perform? The answers are vertical and laterals. The answer could also be anterior, posterior, right, and left. The answer will not be superior, inferior, or as we call those, longitudinals. This is longitudinal, this is longitudinal, this is longitudinal, this is longitudinal. This is vertical, this is vertical, and finally, this is lateral, this is lateral. Start easy. Pick an image, for example, pick this image. Label each side of the image. And if you're getting lost in the imaging, start with looking at, potentially look for the spine, okay? Everybody knows the spine's in the back of the body. So if the spine is close to one edge of the image, chances are that's going to be the posterior side, okay? Here, this is the spine. So therefore, this must be the posterior. And if this is the posterior, simply by process of elimination, I know the opposite of posterior is anterior, right? Start with that. Here, I can also see the spine. So I know that in this scenario, I'm going to have the ability to either move up or down the spine. I have to, kind of get myself visually ready. But localize the spine and use that as like a reference point to start off with. And then you have to think in a three-dimensional view, what part of the spine am I looking at? Am I looking at just one vertebrae like this? Here's one vertebrae. Here's one vertebrae available to me. Here's one vertebrae right here. If you are, chances are you're looking at an axial view. If you can see multiple vertebrae stacked one on top of the other, such as here and such as here, you're looking at either a sagittal or a coronal. And again, using your knowledge about the human body, anatomy, physiology, how everything is lined up, you can continue to determine, is this the right side of the body? Is this the left side of the body? Even in this image, I know this is the liver, and the liver's on the right side of the body. So this must be the right. And simply process of elimination, the opposite of the right is the left. Takes practice. It takes a lot of adjustments to your eyes. It takes scrolling through a million images to really get this down pat. But there are steps that you can take to slowly get there. There's no time limit here, guys. We just want you to get there eventually. During this course, you're going to be doing weekly quizzes. You're going to be, putting your skills to the test. You're going to be pointing structures out. It's going to become a lot easier to discern what you're looking at the more you practice. But I promise you there will be a time when you've done it so much that it's just going to be second nature. Very easy. All right. If you guys have any questions, feel free to email me. I'm happy to break this down further. And I continue to go over this during the weekly live sessions as well. Thank you.